My name's James Barron. I'm a consultant anaesthetist at the Maidstone Tunbridge Wells Trust. I am the Director of Simulation for the Trust, which involves taking undergraduates and postgraduates of all specialities, nursing, medical and allied health professionals, through our simulation suite here and part task training. My view of simulation is that the advantage of it is that we can recreate rare emergency situations in a safe environment. Fortunately, in medicine is generally very safe nowadays. Situations that doctors and nurses and allied health professionals find very stressful, fortunately don't happen that often. There can be, like anything, the more you do something, the better you get at it. So that is a gap that simulation can fill. We can recreate these rare emergency situations so that we can practice at getting better at them in a safe environment. And I think that is the unique selling point of simulation. And the other thing that I see is actually it allows quite junior people to practice taking a leadership role. So it's also very good at preparing people for, as they climb up the rung in seniority. Again, in a safe environment, we wouldn't expect someone who's, first out of medical school or nursing school to take on some, really rare sort of clinical emergency. But in simulation, you can do that. And I actually encourage people to take that on. They're out of their comfort zone, and they may well make mistakes. But in simulation, I think I encourage mistakes, because actually when you really think about your learning experiences, we learn from when things have gone wrong, and we can do that in simulation. It's safe, and often the mistakes are the most powerful learning tools that we have.
So my name's Andrea Cox and I'm the simulation facilitator for the Trust, and that means I'm responsible for simulation training and also for the clinical skills equipment. We have a room here that's available for trainees and students to come and use. I just want people to feel free to come and use the equipment, and the reason we have it is so that people can learn, and so just come and ask anytime, and we'll seek to make that equipment available.
Depending on which clinical speciality you're in, I certainly don't think it's mandatory in any of them, but it would be expected of you to have done that. And for all the same reasons in undergraduate, it's as much about learning about the clinical situation as it is to actually learning more about how you react in those situations, your own behaviours, managing your behaviours and managing the behaviours of the rest of your team. So it's practicing that leadership. And it's also practicing the followership, being an effective team member. So it's as much about the clinical situations and the clinical knowledge you learn as a postgraduate as it is about the human behaviours, the human factors side of managing clinical situations.